autism, psychopathy, depression. These terms, and the way we think about the disorders and behaviors associated with them, have evolved over the years. As psychologists, we want to move beyond the colloquial usage of a term toward a more reliable scientific definition. So we create diagnostic groups based on sets of observable behaviors and scientific principles to help us understand and support a group or individual. EKU psychology faculty are interested in different diagnostic groups. I study autism spectrum disorders. In this video, we'll talk about autism spectrum disorder as a diagnostic group and how our diagnostic tools have changed over time. The Diagnostic and Statistical Manual of Mental Disorders has one example of an operationalization of autism. Autism was first included as a distinct diagnostic category in the DSM-3, published in 1980, as infantile autism. In the DSM-4, published in 1994, it became autistic disorder, and other disorders on the spectrum joined it, such as Asperger's disorder. This change in particular coincided with a burst in the number of autism spectrum-related diagnoses. When the DSM-5 was published in 2013, only one diagnosis remained: autism spectrum disorder. So how do you diagnose when there's no definitive medical or biological test for a condition? This is usually the challenge in diagnosing emotional behavioral conditions, and sometimes for neurodevelopmental conditions like autism. One way that psychologists work to operationalize behavioral conditions is to focus on observable behaviors that are collected with a semi-structured interview. Structured or semi-structured diagnostic interviews have evolved along with the development of classification systems like the DSM. These instruments are used to improve the reliability of data collection and to provide structure to improve inter-rater reliability. Although no instrument is perfect, we can see greatly improved diagnostic agreement and the potential for families and consumers to feel sure about the diagnosis. For research purposes, these instruments can improve the diagnostic consistency that's needed to correctly classify participants. In the field of autism spectrum disorders, the most well-known and carefully developed standardized behavior observation system is the ADOS-2, the Autism Diagnostic Observation Schedule. The ADOS includes activities and not just interviews, because some people with ASD do not communicate in spoken word. We're going to show you a small sample of ADOS-2 activities. We're going to do the bubbles and the birthday party activities. The ADOS tends to be a fun experience for both evaluators and the examinee. The ADOS was created by Dr. Catherine Lord after she completed her training at the University of North Carolina's TEACH program. Researchers and interventionists at this program began highlighting key features of autistic behaviors, and they created a subset of autistic behavior items within a learning profile measure, the psychoeducational profiles. The original PEP was published in 1979, before autism was even in the DSM. The Autism Behavior Checklist aspect of the PEP must have influenced Dr. Lord's later work in developing the ADOS. I also did my doctoral internship at the UNC TEACH program, and by the time I was there, Lord's work on the ADOS was already underway, the first structured diagnostic behavioral observation system for autism. This instrument, the ADOS, now in its second version, assesses communication, social interaction, play, and restricted and repetitive behaviors, the core hallmarks of the autism spectrum. One of the things that interests and frustrates me about the ADOS is that as it has gained popularity, more and more people would like to give it, and even laypersons have heard of it. People sometimes seem to see it as a magical tool that can diagnose autism in the absence of other data or evaluator knowledge of ASD and typical development. This is not true. Even the best behavioral observation system still depends on good clinical judgment and experience, training, as well as data from multiple settings and sources.